Welcome to Longevity Now FL. I'm Luigi Fontana, Professor of Medicine, currently the Scientific Director of the Charles Brinkin Center RPA Clinic and Longevity Program at the University of Sydney, Australia. Today, we're going to talk about alcohol and cancer risk. I already made some videos on YouTube videos about, this topic, and you can go and look at them if you're interested. But this is a new study on basically the effects of increasing or quitting alcohol. It's a population-based cohort study on basically 4.5 million men and women, followed by for 4.4 years. The follow-up was 4.4 years. It is a Korean basically study based on data of the Korean National Health Insurance Service. Though these people were older than 40 years. And again, the exposure to alcohol consumption was categorized into none, 0 gram of alcohol per day, mild, less than 15 grams per day. 15 grams is one drink, so it's like 350 ml of beer, of one glass of wine. Moderate, 15 to 29.9, and heavy, more than 30 grams of alcohol per day. Not only they categorized by the level of alcohol intake, but also for non-drinkers, sustainers, so people who kept drinking, increaser, those who increased the consumption of alcohol, and quitter and reducer. So to summarize, the results are that compared with the sustainer, so those who kept drinking, the increaser, those who increase their alcohol consumption, had a higher risk of alcohol-related cancer and all cancers. All alcohol-related cancers are, as you can see here, head and neck, esophageal, rectum, colon, rectum, liver, larynx, and for female, breast cancer. As you know, is the most common cancer in women. So the increased alcohol-related cancer incidence was dose dependent. The higher the consumption of alcohol, the higher the risk of developing those cancer. And those who changed from non-drinking, so before they were not drinking, to a mild increase in drinking, had a 3% higher risk. Those from no alcohol to moderate, it was 10%. And those who increased to heavy, meaning more than 30 grams of alcohol per day, 2 glasses of wine, more than 2 glass of wine per day, or more than 100 ml of beer, had a 34% increase of risk of developing those cancers. In contrast, those with mild drinking levels who quit drinking had a lower risk of alcohol-related cancer, so a 4% lower risk than those who kept drinking. So these are the major results. And again, these are complementary to many other studies showing that a constant exposure to alcohol does increase the risk of cancer, even for small quantities. So there is no low limit. So why it happens? There are a couple of mechanisms. For example, the link between smoking cigarettes and lung cancer is well established. And it takes many, many, many years to expose to all those basically toxic carcinogenic substances of the cigarettes to cause the mutations and metabolic molecular disturbances that are leading to lung cancer and many other cancers. Similar for alcohol, there are several mechanisms leading to cancer. So the number one is that when you drink alcohol, there is a 4 to 10-fold increase in the activity of an enzyme called cytochrome P 450. When this activity of the enzyme increases, the alcohol gets transformed into acetaldehyde, that is a pro-cancerogenic substance, and free radicals and nitrosamines. All these substances are basically well-established cancerogenic substances. Plus, the second mechanism is that when you drink alcohol, there is an immunosuppression. So there is a downregulation of the activity of NK cells, natural killer cells. These are very important immune cells for fighting cancer. So these cells are recognizing and killing cancer cells, and alcohol is suppressing their activity. Now, as I said, my advice is that if you're not drinking, and it's not only my advice, if you're not drinking, don't start drinking. But if you enjoy drinking, you should do it, intermittently. If you go out with your friends and you want to have one glass of wine or one beer, it's okay. But don't drink every single day. Unfortunately, now there is this very fashionable idea that every time you are with friends, but even with family, you go home and you open a bottle of wine and you pour this red wine into a beautiful glass and you drink. And this is basically has been going on for the last few years for several reasons. I mean, if you watch every single movie, there is always drinking wine, glasses of wine, very trendy, very chic. And one of the idea is that, that many people have in their heads is that, in their mind, is that basically alcohol, wine is healthy, red wine is healthy because it has antioxidant, and in particular resveratrol. This is not true. It has been clearly proven that resveratrol, first of all, you need to drink hundreds of bottles, to get enough resveratrol. But even so, resveratrol, we have proven, and other scientists have proven in randomized clinical trial, resveratrol doesn't do anything in humans. So we published a paper in Cell Metabolism showing that resveratrol supplementation does not change any gene, nothing. Other people that have proven in studies with people with type 2 diabetes, severe insulin resistance, there is no effects of resveratrol. So this is just pure marketing, okay? So it's up to you. In life there are risks. You can decide what type of risk you want to have in your life. The importance is to know what science is showing. And so what I'm trying to do with these videos is just to inform and tell you what studies like this one and other ones are, in this case, suggesting, because these are epidemiological studies, as I've already explained in many of my YouTube videos. Epidemiological studies are just association, so they are suggesting, they are not showing a cause-effect relationship. Yet, the number of epidemiological data combined with cellular, animal, molecular, and some randomized clinical trial are strongly indicating that drinking alcohol regularly every single day is associated with an increased risk of cancer and also with an increase of cardiovascular disease, in particular atrial fibrillation, that is a major cause of stroke, a very debilitating disease. Anyway, thank you for listening. As always, see you soon.